Hi, how may I help you?
Yes, I'm here for an interview with Dr. Tobin today.
Actually, I think he's waiting for you right upstairs.
Okay, thank you.
You're welcome.
Good afternoon, Dr. Tobin. Can you start off by telling us a little bit about yourself, how you got started down the PA path?
Sure. I've been a PA for about 22 years, and I went into the Air Force straight out of high school, and really didn't have a plan for my life. Became an operating room technician for 6 years, and then I was asked to run a urology clinic for 6 years, and then the opportunity that the Air Force opened up their PA program again in the early 90s, and I had taken some prerequisite courses for that, and I got accepted into the PA program. From there, I finished out 22 years and 8 months in the Air Force and retired. And I figured after doing some research in the Air Force, I decided that I would go into education.
Good.
And from there, I did 6 years of faculty in a new developing PA program where I developed a lot of my own curriculum and taught just about all the classes involved with the PA program. And then I was working on my doctorate and was offered a position as the director at Mercer University in Atlanta. And I went there for 4 years to be the director. And during that first couple of months that I was the director there, I got my doctorate in health sciences. And then moved on to here.
Okay, sounds good. So, now speaking of Touro University, can you tell us what makes this program stand out from others?
Sure. Since I've been here, we've implemented a lot of new things at Touro University, Nevada. One, we've started an ultrasound course, which is built into the curriculum throughout the didactic year and the clinical year. We're one of only 8 that I know of PA programs that have ultrasound built into their course, mostly because it's very expensive to buy ultrasounds, and the curriculum is still being developed at a national level. But we've developed that. We've changed a few things with the curriculum to make it more of an outreach school. So we do a lot more mobile health clinic, and we go out and serve the underserved, or those who are falling through the cracks of our healthcare system. So I would say that this program's focus is on helping the underserved and continuing to develop innovative new ways to teach PAs throughout their curriculum.
Right, yeah. No, it sounds like this is a good way to get the students experience prior to actually starting their clinical rotations too.
Yes.
So, nice setup. Okay, so kind of getting into the whole application cycle, what would you say are some key factors you look for in an applicant?
Obviously, when I talk to new applicants or at information sessions, I say, if you just want to be a PA to make a lot of money, this is not your school. Because, as you know, when you first start school in your didactic year that first month, there's probably a good chance that you're going to be out on the mobile health clinic. You're going to be seeing people who haven't been seen for healthcare for a long period of time, those who may not have taken a bath in the last week or so. And if you are not one of those people who want to go out and help those underserved, this is not the school, because that's what you're going to be doing. There are lots of other schools in the country, and they should probably go to one of those. So the first thing I'm looking for is someone who has that heart and that empathy to help those who are less fortunate from us. That's the first thing we look for. And then we look at, whether they are going to be able to handle the curriculum of PA school. And that would be, being able to make it through that didactic year and the clinical year, and then on to the PANS.
Good, very good. So, is this something now that kind of gets into the whole personal statement? Like, is that something that you usually look for in a personal statement? Or is what makes you really want to continue reading in somebody's personal statement?
I want them to come to Touro because they want to be here at Touro. I don't want to be just another school that they're applying to. There's a lot of students or candidates that apply across the country or just pick out a whole bunch of programs. I want Touro to be their number one choice. And I think we offer great curriculum with great experiences, with innovative ideas in teaching, that people should really look at Touro as a place to come to do their PA, no matter where they are in the country. Georgia
Yeah.
or, Washington DC or any of those places.
So is there anything in particular that would stand out in somebody's personal statement, their personal narrative, that would show that they really want to come here versus just somewhere making a very general statement?
Well, I think if they definitely specifically say that they do a lot to help the underserved or have done a lot of volunteer work doing those kind of things, I think that definitely stands out to us.
Yeah.
There are applicants that I can read that I could tell that they're just writing a generic one from the book that's published on how to write an essay for PA school. I've read that book too, so.
Yeah. No, like I said, and of course you're kind of hitting on the next area or next question. I was gonna say, so in your opinion, what do you think is the best way to overcome a GPA that barely meets the cutoff? So like whether it's post-baccalaureate classes, a master's degree, higher GRE scores, positive trend, or even just volunteering?
I know a lot of PA programs look at GPAs. I don't put as much credit in GPAs as probably other directors because I know it's not just the GPA. We want to select the entire applicant. I also know that it depends upon what school you go to. There are schools that you could probably go to and have a 4.0, and there are other schools that you could go to and get a 3.1, but be rigorously prepared for PA school versus the ones who might get a 4.0 at a different university. And I don't know all the universities in the country, so we try not to just focus on GPA. Obviously, you have to meet the basic criteria, which is 3.0 or higher. But once you met that criteria, we look at other things within your applicant. That's why we've instituted the GRE, so that those with lower GPAs can really kind of show us that they can do it with the GRE and get some good scores on that. And that's helping us kind of weed out those with lower GPAs who might be ready to go to PA school. The other thing that we look at is patient care hours, because we don't have a lot of time to teach how to interact with patients. So if you're a EMT, an MA, a CNA, that's definitely helpful. So we already know that you can interact well with patients and people like that. So that's definitely helpful. I'll tell you a secret that we actually put everyone who applies, who meets the criteria, on a long Excel spreadsheet. And you know as well as I do, on an Excel spreadsheet, you can rank order things in different ways. And when I'm selecting people for interview, I will start off with GPA from highest to lowest and look at those individuals. But then I also go to GRE from highest to lowest. I look at those individuals in the different categories even. So if you scored, say, a 6 on your analytical writing on GRE, even though your other scores might be low, you're going to rise to the top, and I'm going to look at your application. I also look at patient care hours. So if you had 63,000 patient care hours, which I have had candidates have, then your application will rise to the top, and we'll take a look at it. So that we're trying to pick out all the top performers in all the categories and looking at everyone as kind of a rounded person.
Good. Very, very insightful. Thank you. So then, now once somebody's actually a student at school, what type of assistance is available, let's say if they're struggling in a particular class?
This is my favorite thing about Touro, Nevada, is that we have Oasis here and we have tutors that have taken those classes, who have done well in those classes, and we have Oasis who can identify what problems are, whether it's a personal problem that you're not doing well on tests, or is it the way you're taking tests. At other universities that I've been at, usually if you had made it to grad school and you didn't know how to study yet, they just said there's no hope for you. I don't think we do that here at Touro, Nevada. If you come here and you're having problems with your studies, we've already accepted you as a student. We're going to do everything in our power to keep you here as a PA student. And by doing that, we get you set up with a tutor. We look at how you're testing, how much you're studying, whether you're studying enough, whether you're learning those concepts that you need to know, so that you can gradually get better at that. Where some other schools might just kind of release you that you're not ready for PA school. That's not what we do.
And that kind of hits on a little follow-up to that too. Like, what can you share with us the attrition rate for PA students here?
We don't really have an attrition rate. Right now, all 3 of my classes, the one that's going to graduate and the 2 other ones, have the same amount of students that we started with. That doesn't mean that we don't lose students. And different things happen within PA school that interfere with our learning. It could be personal, and most of the time that people have left PA school or were dismissed from PA school, it stemmed back to some kind of personal issue that was going on outside of PA school that made it hard for them to study. There are people that come that are not prepared, and they are so far behind the power curve that they are not prepared to handle the rigor of PA school. And we try very hard to pick those people out before we select them for PA school, but sometimes it happens. And we do everything in our power to keep them here, but that happens. So right now our attrition rate is really 0.
Okay, so you guys...
For the last 3 years.
Yeah, wow, okay, that's very good.
And we plan on trying to keep that as much as possible. And I think we can do that better here than other places because of OASIS, because of all the help that we give students who are coming into this school.
Okay. Could you talk about the remediation process at all? If somebody, let's say somebody actually fails a class, what steps are usually taken, or?
Well, we keep our remediation here called the Promotion and Advancement Committee, which is made up of all the faculty within the PA program. And also one of the directors of OASIS also sits on that. And we will review the entire person, not just because they failed one course. And we look at what things we can do to help that person. Can we remediate them with a new test, or is there some kind of personal problem that our on-site clinical psychologist can help that person with? Is there something else that happened during that time? So we look at the whole person, and then we try to make a decision on what would be best for them. And that decision could be from retaking a similar test for the final that they took, retaking that course again, maybe just not going to PA school after all. Maybe they don't want to be a PA after all. So there might be some deep introspection about what they want to do.
Okay, all right. So since we have time, we're going to kind of circle back through things. I know this is
Sure.
going to be a little bit out of order,
I'd love
but
to.
so kind of getting back into the program, if there was one thing you could change or improve about the program, what do you think it would be?
Well, obviously, as a director, I get to change those.
Yes.
That's the best thing about being a program director is when I see things that need to be changed, I will trend those things and look at those over a period of time and then come up with experts who can come up with ideas on how we can change things. If there's one thing I could change about this PA program, I would be changing it. So, since I've been here 18 months, there's been lots of changes to the curriculum. And so we take a lot of input from students, from faculty, from outside adjuncts, and we actually get together periodically and say, okay, this class doesn't seem to be doing well, or we can make this test better, or we can make this experience better. A good example would be physical diagnosis lab, which you're going through right now. It's too late for us to make huge changes to that class, but there are some small changes that we're going to make this year. And next year, we plan on revamping the entire class and changing it around completely. So we've gotten that feedback from students in the past, from faculty in the past, and I suspect that when we meet with your group or your class, they will recommend that we change some things around in that class. So that's kind of our number one, at least didactically, that we're going to be changing around.
Oh, well, that's important too, though, the fact that you actually take student input and then try to implement it.
Right. The things I really love is that senior classes or classes ahead of the other classes, when we implement new and innovative things, they're always saying, well, why didn't we do that when we were here? But we're actually implementing those based on their feedback. So we are actually taking action on their feedback. And they love that because I have students who are graduating who are like, well, I wish I got to do ultrasound while I was in didactic class. Or, oh, I wish we had done it that way when I was, in didactic or in clinical. So that means I'm on the right track. If students are wanting to come back and redo that course again, just because we've changed it to a better learning environment for the students.
That's great. Okay. So back into the applicant cycle a little bit. Now, I know you said you look at the higher achievers in different areas, but are there certain majors or degrees that usually look better on paper or even versus reality once they actually get into PA school?
I actually like people, when we're building out a class, we look for different ethnicities. We look for different sexes. We look for different age groups, because that makes a class richer by having lots of different kinds of people in the class instead of a very young, right out of undergraduate group of people. So that just makes the learning better for everybody in the class. And that said, I look for different kinds of degrees. So we're less concerned about what degree a candidate has, but more how did they do on the prerequisites? How did they do on the organic chemistry? Now, by the time you get done with our prerequisites, you probably almost have a biology degree in most universities. So I would say our greatest is biology. But when I have candidates who are dance majors, foreign language majors, all those kind of things, it just makes the class richer when they come on board.
This a little bit of a tangent, but I know I spoke to someone on a different admissions program, and the best description I've heard was thinking of the Breakfast Club. You think of that group of people, you're going to have a wide variety of somebody from every different background. It's a great way to describe the class because everybody brings something a little bit different to the table too.
Right, and we teach team healthcare, which means diverse people coming together for one common good. And I think the more diverse your class is, the better that works out for you.
Oh, yeah, good. Okay, so, well, Mary kind of touched on this one, but what do you think makes a great PA school student, just in general? So once they're actually here in the program, some of the qualities, attributes, dedication to study, whatever it may be, what do you usually see in the students that tend to excel?
I think all students are different. I have students who may not get very high GPAs, but they're very focused on treating the underserved, being out in the mobile health clinic and stuff. So I guess it depends upon your definition of success. My definition of success of a PA student is not the people who score in the 90s. And actually, there's a lot of studies that show those people don't go on to big leadership positions within the PA world. It's the people who got in the 70s and the 80s that are actually more of the leaders in the PA world today. So when I'm looking for a great PA student, I'm looking for that person who's willing to volunteer their time. If an event's happening on Saturday, they're the first to volunteer. Those are the people who are going to help other people. And when I speak to presidents of the classes, I always say, you've got a few people who are struggling. I don't talk to them about how many people are getting A's. I talk to them about, you have some people struggling, how is the rest of the class helping those people get through PA school? And I would rather have everyone get B's and no A's and have the whole class graduate than to have everyone gunning for A's and lose some people in the class. And so usually my focus is to get the class as a whole to kind of come together, bond, and help everyone kind of come through PA school.
Yeah, I would completely agree with that too, because I know that's one thing that I guess you don't realize it until you're here and you're actually in class and interacting with everybody, just the true sense of community. That's, yeah, I didn't realize how much of a community it truly becomes when you're here.
And I think that's special for the PA program here. At other programs, even within this university, there's a lot of competition because depending upon their grades, going on to further education can mean the difference between, a 100th of a percentage point on their grades on whether they may go do this residency or that residency. And we don't have that. So it's helps everyone to team educate and learn together and get everyone through.
Yeah, very good. So, again, touching up on a couple other things too, as far as the application process goes. Would you say, now when you're looking at the prerequisite courses at all, do you think it makes a difference at all as far as whether they get it at the community college or the university?
Yes, I believe, because a lot of people are just fulfilling those prerequisites, but I'm looking at the prerequisites that are going to get you through that first session. And you know as well as I do, the first session is, in like the first month, they do a whole year of biochemistry. And if you haven't had a good biochemistry course before you come to PA school, you're usually floundering and having a hard time with that. So the better education you get in your prerequisites, the easier PA school will be. And you want PA school to be as easy as possible. So the online schools are usually not very rigorous, and so probably does not weigh as much when we're making decisions if you come from an online school. Sometimes community colleges can be just as rigorous as regular universities, so it's hard to gauge that. And that's where that GRE comes in, because there is some heavy science in one of the tests. So we can kind of gauge, whether their prerequisite education was rigorous enough to help them through PA school.
Okay, very good. And so, kind of hitting on those same lines, now if somebody has an outstanding course or two, does that weigh that much to you, or are there certain courses that you would rather see people have already completed, like biochemistry, for example, and maybe they have, I don't know, say anatomy 2 that they're still working on, or some other class? Does that matter so much on an application?
If they have a good track record with all the other prerequisites, 1 or 2 is not that big a deal. If I wanted if I could pick one prerequisite that I think I would like to see before they come for an interview, would be organic chemistry. There's actually some good data out there that shows that the score in your organic chemistry class predicts how well you're going to do in PA school. Now, organic chemistry is a tough course, so obviously smart people are going to do well in PA school, and I think organic chemistry is a very tough course in undergraduate. But if a candidate's getting very good grades, A's and B's, in all the prerequisites, and they still have 2 outstanding, we would consider that those are going to continue. But if that candidate is having some very poor grades in a lot of the prerequisites and still has some outstanding, that would be a concern, because I don't know how well they're going to do in those other classes.
Okay, yeah, no, that's a great point. And then one last question. So as far as letters of recommendation go, do you like to see them from certain type of people, whether it's a professor or a PA, doctor?
Well, obviously, if you're applying to a PA program, you would want a PA. PAs who are associated with the PA program, I think, count even more than PAs. PAs who are academic PAs count more also. So when I'm looking at letters of reference, I always look at who the PA's name is, because I don't know all the PAs, because there's 115,000 of them. But I do know a lot of PAs, being PA for 22 years. So I always look to see if I know them. And if I have questions about the candidate, I feel more comfortable calling a PA, because I think they know what it takes to get through PA school. Some people mistakenly think that getting a physician's letter is better than a PA, which is not the case. Physician letters are fine, but obviously you're going into the PA school, not an MD or a DO school. So the first choice I would have in getting letters would be from a PA who knows you, who knows your caring attitude and how you interact with patients. So that would be better. Letters from physicians and DOs, MDs and DOs are also fine. Many people get letters from professors, because there are some schools that require you to get a letter from a professor. I think that pushes the PA world into accepting people straight out of undergraduate, which is exactly what I talked about before, that we don't want to do that. So we don't have that requirement for professors, but I definitely look at that. People connected with the program. whether they're a physician or a PA or something. But if they're connected with the program that you're applying to, I think that's very helpful because we know those people firsthand. Nurses that they work for as a CNA or something are sometimes helpful. Historically, I've noticed that sometimes letters from supervising nurses are not good. So I always kind of look at that a little closer when someone gets a letter from a supervising nurse that they've had as a CNA. I've had a lot of letters over my last 11 years in PA education. Letters from celebrities do not help that much because I know that the celebrity doesn't know them that well, but in some instance they know them and write the letter for them. Or large CEOs of companies, it's almost like dropping names, which is not necessarily good if you're a candidate trying to get into PA school.
Okay, so being humble would be helpful. I
Yes.
guess, yeah. Okay, so that concludes all the questions I have for you. Is there anything else you'd like to add as a closing thought? Anything?
No, I think in the next couple of years, Touro, Nevada is going to come out with a lot more innovative ideas, a lot more things that the students will enjoy learning. And we are definitely watching how our students progress through our curriculum and through the clinical year. Obviously, I always am saying to the students that graduation is not the end, taking the pants is the end. And the other great thing about Touro, Nevada PA program is that we monitor how our students are doing and statistically base that off of an algorithm to look at their predictability of passing the pants. And if that predictability is showing that there's a risk of not passing the pants, we already have curriculum set up to send those small majority of students through some more testing and some more rigorous education to hopefully bring them up so that they are able to pass that. And so this year in November is going to be the first time that we've kind of fully implemented that. So we're looking for an increase in our first-time pants pass rate. And we hope that works out. And if it doesn't, if we still get the same results, we will go back to the drawing board with experts, with people with PhDs in education, that will look at ways we can fix or actually educate those that are kind of falling behind better throughout the year.
Great. Okay. Well, thank you for your time, Dr. Tobin. I appreciate it.
Sure. Thank you.